All right. Oh, my charger unplugged. All right. Hello, my name is Alicia. I'm a Vader nurse practitioner today. We are going to be doing a examination on you today. We are going to be looking at your respiratory, cardiac, abdomen, thoracic, extremities, and some neurological functions. I'm washing my hands. I'm providing for privacy. So juicy. So first things first, I'm going to look at your posterior thorax. So could you swing your legs to the edge of the bed for me? Yeah, no, it's weird. I'm sorry. Or just swing your legs up and over. I got to get to your back. Beautiful. Beautiful, beautiful, beautiful. Alrighty, let's untie your gown. Drape it in a little bit. Alrighty, so I have already obtained his vitals, well the nurse did, and we reviewed him. His temperature is 98.6, blood pressure 120/80, respiratory rate of 20, oxygen saturation of 98, weight of 220, height of 5'10", giving him a BMI of 32. And his nurse reports that his initial claims were for some flank pain, right-sided flank pain after lifting a heavy load. So first I'm going to inspect. There are some scars, some moles, no redness. From what I can see from his bony prominences, they do appear symmetrical. Next I'm going to palpate for any pain. Can you feel any pain?
No.
No. Alrighty. So next I'm going to palpate for tactile phrenitis. So I'm going to put the balls of my hands on your chest, and I'd like you to say the word 99.
99.
And every time I put my hands down.
99. 99. 99.
Alrighty, so they are a lot more vibratory up on the top part, and they do diminish as you go down. If they were more prominent in the lower aspects, you'd be concerned for consolidation. So next I'm going to percuss. So I'm going to percuss bilaterally. What I'm hearing is kind of a dull, resonant sound. There's no timpani or anything like that. I also note that there's no use of accessory muscles. There's no retractions. He doesn't appear that he's in any kind of respiratory distress. I'm going to listen to his lung sounds bilaterally. Alright, so when you feel me touch down, take a deep breath in and out, please. Alrighty, lung sounds are clear. There's no rales, no wheezes, no rhonchi noted. So next I already palpated and asked him to say 99. So I'm going to ask him to do the cacophony. So we're going to say E. So when I touch down, say E for me.
E. 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 E.
Alrighty. So it sounded louder up here, and then it got more diminished. If I would have heard an A or a louder sound, it could have been consolidation. So it wasn't nasally at all. And I did hear bronchial sounds up here and more What's the vascular one? Oh yeah, vascular bronchial sounds throughout. So I'm gonna note his posterior dimension to his lateral dimension, and it's about a 2-to-1 ratio, which I know in fact is normal. Could you go ahead and turn around for me? It's beautiful. While I was back there, I was also looking at his spine to make sure there was no pain or tenderness. Next, I'm going to take your gown down. I'm going to look at his chest, and it looks symmetrical. It's pink. There's no lesions. There's a scattering of hair. Any pain?
No.
No. And so I'm a tactile parameter, say 99.
99. 99. 99. 99.
All right. No, the text, it was more vibratory down here as opposed to down here. Next, I'm going to listen to his lung sounds anteriorly. I'm going to start above the clavicle. Big breaths in and out. Sorry if I make you dizzy. Alrighty, so clear to auscultation. Can you kind of turn so your chest is facing this way a little bit? Don't look your feet. So clear to auscultation, no adventitious sounds, there's no rhonchi, no rales, no wheezing. Next, I'm going to palpate for his cardiac function. So second intercostal space on the right side of the sternum, I'm going to feel for his aorta. Across the sternum to the second left intercostal space, I'm going to feel for the pulmonic. Down one space to the tricuspid, herbs, down another to the tricuspid. And then midclavicular line with his nipple. I'm going to feel for his point of maximal impulse, or his PMI, or his mitral location. I'm going to lean forward and over to the left. There we go. I could feel some thumping on there. Sit back and straight, ignore them. I'm going to listen. Alright, second right intercostal space. Beautiful. To the left intercostal space to the sternum. Down to the third for herbs. Down to the fourth for tricuspid. And midclavicular line below the nipple for the mitral valve. And I'm hearing S1, S2, no rubs, clicks, or gallops, no rubs, I don't know if I said that. I'm going to listen with the bell now. Same things. Now I'm going to pay special importance on the aortic valve, so lean forward for me. I'm going to listen for aortic murmur, which I don't hear, and then lean off to the side for the mitral valve. Beautiful. And I didn't hear any murmurs. Oh, turn back around. I forgot something on your back. I would assess for bilateral. Sorry. I'm going to push my hands in. Take a big breath in. And my hands rise symmetrically. And good. Sorry about that. Come back around. You're doing great. All right. So next, we're going to do the 99 for the tactile front. No, did I do that on the front already? We'll do it again. Say 99.
99. 99. 99.
Alrighty, some more vibratory up here. Bronchial sounds up here, some bronchial vesicular sounds, and more vesicular sounds down here. Alright. Go ahead and lay down for me. Keep your, you can pull your gown up. This is weird. Can you scoot so your boot is down a little bit more? Alright. So, rest. My NIH scale. an IH scale fell, sorry. Alright. So, for his lungs, cardiac, I was listening for S1, S2 sounds. There was no S4s, no gallops, no clicks, no rubs. Moving on to the abdomen. So, on the abdomen, I'm inspecting. I don't see any strigae, no abnormal vasculatures, no lumps, no bumps, no masses. His umbilicus is inverted. And so, can you see it? Alright. No lumps, no bumps. So, next, I'm going to look for any, like, scars or anything like that. I don't see any. So, first thing I'm going to do is I inspect and then I auscultate. So down here, I kind of want to listen for the aorta, see if I can hear it, which I can. I don't hear any bruits. Listen with the bell and with the diaphragm. Same thing with the renal arteries. Alright, and then I'm going to feel for the artery, the aortic artery, abdominal aorta, and with my other finger, sorry, did I press too hard? Alrighty, so the space between my fingers is maybe about 1.5 centimeters, which is normal, there's no dilation. Next, I'm going to auscultate his abdomen. I'm going to listen for bowel sounds, starting with the lower right quadrant. And he's got some pretty active bowel sounds. Good. Any pain in your belly?
Nope.
Alright. So I'm going to do light palpation first. Any pain?
Nope.
Don't push against me. Alright, good. And then I'm going to do some deeper palpation. Alright. And then I'm going to percuss. Over the stomach, the gas ball especially. I hear some tympany. Some dullness where I'm expecting either some fecal masses. Alright, next I'm going to try to find his spleen, which is on the left side. If it was going to be enlarged, it would come down towards his belly button. So don't push, relax, breathe out. Alright, and I don't feel any enlargement, stop it. And then I'm going to feel for the liver. Alrighty, so I'm going to stand up here. I'm going to take a deep breath in and blow out. So I'm not trying to tickle you. I'm trying to feel your liver edge. Stop it. Blow out, please. Alright, well, either you're giggling too much or it's up underneath your ribs. So then I'm going to percuss for the liver to check the liver span. Oh, rats, where's my marker? I'm going to take a measure. I drew it on you, I'm sorry. That tender or is it just me? Feeling for your liver dimensions, sir. Anything between 6 and 12 is normal in centimeters. Just how much you are. See if you're normal. Wow, 6.5. You're right on the money. I feel for your inguinal lymph nodes. Don't giggle. Don't giggle. Horizontally and vertically. I don't feel any lumps or bumps or anything like that. So since he was complaining of right-sided kind of flank pain, I will check for psoas sign and an the arbitrator, what is it? The arbitrator sign. So for this OS sign, I'm going to go to the right thigh. I'm going to hold his thigh down. I'm going to ask you to lift up against my hand. Lift your leg up. Good. Any pain?
No.
Okay. Alright. Put your leg down. Any pain?
No.
Okay, good. I feel like I'm forgetting something on your tummy. Oh, we're going to lift your leg up. Roll your leg a few times. Roll your ankle, I'm sorry. We're going to drain the blood out of your leg. Alright, and then grab my hand. We're going to sit up. And sit up. No, come, sit up. Alright. And it usually takes about 10 seconds for the blood to return to your extremities, which it has, and that's great. So that was, to check your legs. We measured your aortic span, we percussed your abdomen, where am I? Alright, what did I didn't percuss your diaphragm, raise you up beyond the back. So take a big deep breath in for me and blow it out. Alright. Alright, now again, breathe in and blow out. Alright. So I'm looking for your diaphragm expansion. And I've got it at 5.5, almost 6 centimeters, which I believe 4 to 10 is normal. Okay. Alright, so we can cover your back up for modesty's sake. Alright. Put your feet down for me, sir. Scoot your booty back. We're going to assess for pulses. We're going to do radial, which is a +2. Brachial, +2. You're going to go up with your gown. Look good front popliteal. That's part of your peripheral vascular exam, sir. I would say maybe 1. No, 2. Posterior tibial. Good. Good. And dorsal pedius. Alrighty. And then I'll do, I gotta mix them, but it's either the Allens or the Phalens. I'm gonna do both, but anyway. Allens for artery insufficiency. So I'm gonna, relax. I'm gonna occlude both your ulnar and your radial nerves, arteries. Strain your hand out for me. Open your hand for me. And then I'm gonna let go of your radial. Wow, look at your color come back. That was great. And we're gonna occlude again. We're gonna let go of the ulnar. Oh, look at that blood return. That's beautiful. And then for the phalens, put your hands together like this and push. Push as much as you can. Any pain, numbness, tingling in your fingers? No. And I'm gonna take your hand. I'm gonna turn it over, and I'm gonna hit your median nerve. Any pain?
Nope.
Let's check for carpal tunnel. You already had yours fixed. Alrighty. Alrighty. So I already inspected them before I palpated them. Stop picking. He has a scab right there, so I would note that on my assessment. Otherwise, besides that small scab, his extremities do appear intact. There's no nodules, no crepitus, no masses. Alright, so inspection. Now we're going to do range of motion. Can you wiggle your fingers for me? Can you close your fingers? Extend your fingers. Bring your fingers out for abduction and bring them in for adduction. Good. Roll your wrists and then flex and extend and then in and out. God dang it. Alrighty. So now I'm gonna assess hand grip strength. Go ahead and squeeze my hands. Squeeze my hands, sir. Ow. Okay, he's +5. And then put your hands up, and then press against mine. No, just your wrists.
Oh.
Press against my hands. Okay, good. Now, pull your fingers up. Pull your fingers up. There you go. Good. So, +5 in his wrists as well. And then, so, moving up to the shoulder. Sorry, get your neck again. No lumps, no bumps, no masses. He's got a tattoo. Palpate any pain.
Nope.
No. He's warm. Alright. So now range of motion. Put your gun back up. Apologize. Alright, so we're going to abduct. We're going to adduct. Going around in a circle. Beautiful. So that's your shoulders and your elbows. No pain. Bring your arms up and down. Good. Now pull against my hands. Oh, God. Alright, now press down. Okay, good. Shrug your shoulders up. +5 on both his shoulders and his arms for musculature strength. We'll do some deep tendon reflexes. Alright. So I'm going to hold your hand. And I'm going to check to see if you contract, which he does. Hold my arm. We're going to hit your brachial tendon. Good. And then kind of up and out. And then, beautiful. Checking for contractions. They're very brisk. I would do so bilaterally. And then we can do this one now too, I guess. So I'm going to strike my tuning fork, and you're going to tell me what you feel. Ooh. What do you feel?
Vibration.
Good. All right. What do you feel?
Vibration.
Good.
Vibration.
So his conduction sensory is intact. Go ahead and lay down for me. We're going to move down to your, scoot up all the way up on the bottom because we're going to check your lower legs. Lower extremities. So we got to do the NIH scale too. Okay. Keep your boy parts covered up for privacy. So I am inspecting. He's got another scab here, but otherwise skin is pretty much intact. No other deviations noted. No redness. Any pain?
Nope.
No. No swelling. We'll start with the toes. He's got some good capillary refill. Can you extend your toe, open your toes for me? That's adduction. Now bring them together. That's abduction. Good. Bring your toes up to the ceiling. And down. Down like a gas pedal. Good. Alright, so range of motion is intact, and I'd give him a strength grade of like a 4. Moving on to the ankles. Can you roll your ankles in a circle for me? Good. And now bring your feet up again. No crepitus noted, and down. Alright, and then bring the the soles of your feet together so I can check for your, no, just like pump. Yeah, sort of. Good. Okay, that's enough. Thank you. Alrighty. So we'll check for Hohenstein. Go up. Push your foot down. Bend your knee a little bit. Any pain?
No.
Alright, and push your foot against mine. No, just your toes. Good. No Hohenstein, no pain, no redness, nothing noted in the calf area, so I would check bilaterally. His knees, inspected them, palpating them, no crepitus, no redness, no warmth noted. His popliteal pulses are intact. Can you go on ahead and raise your knee up for me? We're going to flex and extend, and we do so bilaterally. So now bring your knee up, bend your knee, and then pull your foot down for me. Okay, good. Now raise your foot up. Pull your foot up in the sky. There you go. Alrighty, so I'd give him a +4. And then so for his hip, I would check. when he's naked. There's no redness, no swelling, nothing like that. Any pain? Are you just being ticklish?
Yeah.
Okay. Bring your leg out to the side for abduction, internally for adduction. We're going to go up. We're going to go down. Any pain with that?
No.
Okay. Now raise your leg up. And then bring it down. Good. Alrighty. So, let's set you up, my guy. Nice and slow is the way to go. Alright, kind of sit on the edge there for me. Alrighty, so I'm going to check your sensory down here on your feet as well. Tell me how you feel.
Vibration.
Really good?
Vibration.
Over here?
Vibration.
Good. Oh, I forgot to your displacement. Close your eyes for me. I'm gonna move your toe. Tell me where it is.
Up. Down. Up. Down.
Okay, good. Keep your eyes closed. I forgot your fingers too.
Up. Down. Up.
Okay.
Down.
Good. Did you say out or down? Alrighty. So then, for your legs, we're also going to check deep tendon reflexes. Take your hands and pull them against each other for me. There it is. There it is. And then just relax. Good. So, that's just so you didn't hyper-focus on what I was doing. And
Oh.
yeah, they're pretty smart with these things. Alrighty, so then I will have you close your eyes while you're still sitting down. And we're going to assess your major dermatomes. We're going to do a soft and light touch. So tell me what you feel and where you feel, okay?
Shoulder. Right shoulder.
What is it? Sharp or soft?
Sharp.
Okay. What do you feel here?
It's soft. On my arm.
What do you feel here?
Soft on the back of my hand.
Here?
Scratchy.
Sharp.
Sharp in the back of my hand.
Down here?
Soft. Ow.
Okay.
Oh, yeah. Sharp.
Okay.
Foot. Top foot. Sharp. Leg. Right.
Beautiful. That's good. That's golden. Alrighty. What else do we gotta do? While you're sitting, well, what the heck is it? It's for the coin. Oh, I told you it's a coin. Hold on. Ignore the coin. Close your eyes. Let me put something else in your hand. Can I hold your hand? Alrighty. Close your hand. Go ahead and tell me what you think that is.
Key.
Okay, good. So, that's beautiful. So that is stereographic, I think. And then I'm going to draw something in your hand. You got to tell me what I'm drawing, okay?
Mm-hmm.
What am I drawing? Okay, let's try again. What's this?
Circle.
Okay, good job. It was a heart on the other side.
Oh, okay.
Alright, before I have you stand up and do your walkie thingy, we'll do your NIH scale. I'm going to have you remember 3 words. They're going to be penny, table, and bed. Say them.
Penny, table, bed.
Good. I'm going to have you look at here and tell me one thing wrong in the picture.
Just one thing?
Just one thing. I know.
Oh, there's paint on the floor.
Yep, that's a good one. Alright. Read the sentence for me.
You know how
What's this one?
I got home from work.
Good. And then we're going to check some shapes. Tell me what this is.
Light.
What's this?
Bucket.
What's this?
Mouse.
It's pretty good. Alrighty. So then I'll have you stand up. Oh wait, before you stand up, I'm so sorry. We're gonna do the finger touch. So I'm gonna have you extend. This is to check to see if your cerebellum is intact. We're gonna put your hands up And so we're checking as many joints as we can for flexion, adduction, all that fun stuff. And then touch your nose. And touch your nose. Now do it as fast as you can. Okay, beautiful. All right, now go ahead and stand up. We're going to check your gait. You can take this down. I'm going to tie your gun for you. All right. Before I do that, bend over for me. I'm going to check your spine, make sure you don't have any scoliosis, any pain, any tenderness. Okay, come on back. We'll check your range of motion. Bend over to the right. Bend over to the left. All right, go over towards the window for me. Good. I'm checking his normal gait. All right, come turn around. Tiptoe towards me. Good. Turn around. Walk on your heels. You little pretty princess. All right, and then tandem walk. So put your heel in front of your toe. Heel to toe. There you go. Can you not do it? Oh God, you're neurologically not intact. Beautiful. All right, stand still. Close your eyes. We're gonna check a Romberg test. See if you get dizzy or anything. All right, that's fine. You're good. And then repeat those 3 words that I told you earlier.
Apple tree penny?
Oh, you got penny, right?
Yeah, I don't remember.
Table and bed. Oh, God. All right, I think we got it.
Is that bad?
Yeah. Oh, we went